Hello, my name is Panayotis Housakos, and this is my PowerPoint presentation of my research topic of impacts of COVID-19 lockdowns on the mental health of school-age children. Faculty advisor is Dr. Orlando. This was a narrative review. So during this PowerPoint, I'm kind of going to go over my paper. It's all encompassing, but try to touch on the key topics that I went over in my paper, but specifically if you want any further recommendations or questions, my paper will have all that information, and you can also contact me as well. So this is the MPH program. So, but specifically, since MPH is kind of a broad statement, it's or a spectrum. Specifically, my track was preventative health, and these were the core competencies up top, and then on the bottom is the preventative health ones. Introduction and background. So this is kind of what I was initially trying to decide on the topic. These were the thoughts that I was going in through my mind. So school systems changed during COVID-19 crisis and lockdown policies. It's just kind of the overall idea of what was kind of going on during this pandemic. The uncertainty that the pandemic created in the virus itself, resulting in the discontinuation of the class-based learning and the transition to online-based learning, which is, in my opinion, it was a big jump. Maybe a jump that was a little bit too quick. I think we were kind of gearing towards that in the next few years, but I think kind of COVID-19 expedited that, unfortunately. School-age children's lifestyle was disrupted socially. Just as above, it's the idea of class-based learning, kind of that face-to-face, to now this people are just staring at a screen all day. Pandemic lockdowns was a sudden experience, new to many school-age children. Again, it was new to the adults, and it was just as new to the children as well. The research question. So when formulating a question, I had to kind of think very broad, and then I tried to get as specific as possible for my paper. But the thoughts kind of running through my mind were the increase in mental health problems resulting in the pandemic lockdowns. School-age children were the most affected compared to other populations. Were they? Psychological effects resulting from the experience of lockdowns have lasting effects. So those were the kind of thoughts that I was thinking. The overall question would be, how did the lockdown protocols impact the mental health of school-age children during the COVID-19 pandemic? So this is age groups between around 6 to about 18. So kind of right before the adult transition and when they were going into from preschool to kindergarten and first grade. Those are the age groups that I was going for. Methods, Google Scholar for the research tool, PLOS one, science.gov, Scholar database, Medline, and APA and Tor as well for the data collection. I use structures kind of electronically. I used like an Excel sheet to try to organize all the different articles and try to formulate them there, and then kind of piece them together on what I can get from each article. Research approach, I use the Prisma guidelines, more on that on the next slide. Temporal focus, so again, that's COVID-19. So this is again, SARS, the virus itself was always around, but the pandemic in our generation happened in 2019, and it's kind of lasting till now. So when I say present, currently it's 2024, but I very much see this going beyond 2024. So I didn't feel comfortable just putting 2024. I think we'll still be having the same similarly discussions, I think in the years to come. Search strategies, I use the keywords of COVID-19, mental health, school-age children, and etc. When looking up specific papers. And then information gathering, kind of went very broad, and then I try to narrow it and focus it with the above. And we'll talk about the inclusion and exclusion topics as well. So inclusion criteria, on the right, we see the Prisma diagram, and just not to get too specific, there's many articles, and depending on the inclusion and exclusion criteria, I tried to narrow and focus specifically on what I wanted on the paper. So inclusion was English, papers. Pandemic was worldwide, but specifically competent in English. So I focused on those articles. Measuring the mental health, specifically outcomes, quantitative methods, inclusion of school-age children in the study, employment of cross-sectional and longitudinal research studies, no case reports. I wanted more like a broad time frame based study. Exclusion criteria were studies other than English, children that already had mental health conditions such as autism or neurodevelopmental disorders, homelessness. I didn't want any kind of external factors affecting this. Exclusion of minors with pre-existing health conditions to enhance results clarity. And then case reports, I didn't want anything specific. I wanted kind of like a broad population. So results finding. Each paper I read and kind of wrote about and touched on kind of had an overall kind of theme for the most part, or at least when I read them. So these are the few things that I found out. Parental relationship between the parents and the children, along with the relationship between each parent, were paramount during the COVID lockdowns with the health and the well-being of the children's, their mental health and well-being. Minors in lower income families were impacted considerably more compared to people in like higher socioeconomic classes. Socialization was a big thing as well. Single children or like multiple children in the household. School-age children and their parents showed similar emotional symptoms and distress. So kind of if the adult in the house isn't well enough to be able to cope with said stresses, maybe the loss of a job or stresses at the job or not being able to work because if there's at a point there was only essential workers that were allowed to help, that kind of and moved into the children's mental health as well. Stresses and inability to predict adverse mental health. So this is kind of unprecedented. We didn't know what was going to go on between the transition of online to, or transition between in-person to online and kind of everyone in their self. So we kind of underestimated the social mental aspects of what these lockdowns could do. Discussion, COVID-19 lockdowns and overall impact of children's emotional and social growth. The ecological systems theory explains children's environment disruption, which is the idea of where we encounter different environments throughout our lifetime that may influence our behaviors. School-age children's experiences and coping mechanisms, I think, were also affected during this time. Practical strategies and psychological and emotional support were, I think, necessary during these times specifically. Recommendations, I think this was kind of the most important thing that I was trying to do personally, and seeing what we could do to kind of help these children develop, quote unquote, normally. Screen time, I noticed increased during COVID-19 lockdowns. So putting limitations on screen time and smart tablets and things like that. And also promoting physical activities, not just kind of, you're locked down from the public, but you're not locked down from going outside or playing in your yard if you're able to, or locked down in your room. You can play in the living room if you don't have a yard as well. And kind of the parents kind of not necessarily forcing, but kind of promoting that children should be playing. Social connections, emphasizing the importance of maintenance of social contact with friends, community involvement as well. Kind of goes with number 3, but more on the outskirts with like neighborhoods, accessible to mental health support. I think this is also paramount. If people need to reach out, they should have support systems in place. And that we kind of need to, as adults, see that these school-age children are more vulnerable than adults as well. Prioritizing the young person's mental health and wellness. I think a lot of the issues that we came up with was because of we weren't sure if it was going to affect these children, and it ended up doing it. So we're kind of caught at the end, not knowing what we could do. But I hope these recommendations are something that we can kind of move forward and go from there. And then the following slides are just the references. Thank you.